Hello. I am ASMSC Sports Medicine Science channel that correctly conveys information on sports medicine science to everyone. Let's learn the basic knowledge of sprained ankle this time. The illustration on the left shows the state of the joint at rest. A joint is a part where bones are in contact with each other. Around it are tissues such as ligaments that hold bones together and stabilize joints. When we usually stand up, walk, or run, we move within the range where our joints do not break. In other words, it is a motion in the physiological range. Look at the figure in the middle. It looks like this. At this time, the ligaments that hold the joints together are tense to the extent that they are not damaged. But what if you were running and sprained your ankle? Joints will be moved beyond the physiological range. Look at the illustration on the right. The image looks like this. At this time, the ligaments that hold the joints together and the joint capsule that covers the joints are pulled and damaged. This is what happens at the joints when you sprain. An ankle sprain can be divided into two types. The first is the inversion ankle sprain on the left side of the screen. This injury twists so that the inside of the foot is float. This injury occurs when you step on another player's foot during a jump landing, or when you stumble while running. This injury often damages the lateral collateral ligament of the ankle, which is the ligament located on the lateral side of the ankle. The other is the eversion ankle sprain on the right side of the screen. The eversion ankle sprain twists so that the toes face outward. This injury occurs during rugby tackle and cutting movements such as soccer and basketball where an offensive player overtakes a defensive player. This injury often damages the deltoid ligament of the ankle, which is the ligament located on the medial side of the ankle. In this way, an ankle sprain can be divided into two types. First, let's take a closer look at the inversion ankle sprain. The inversion ankle sprain often damages the lateral collateral ligament of the ankle, which is the ligament located on the lateral side of the ankle. Look at the photo of the foot on the right side of the slide. This is the view of the right foot from the lateral side. The lateral collateral ligament has three ligaments. One is the anterior talofibular ligament, which connects the anterior talus and fibula. The other is the calcaneofibular ligament, which connects the calcaneus and fibula in the middle. The third is the posterior talofibular ligament, which connects the posterior talus and fibula. The anterior talofibular ligament is the most vulnerable ligament in lateral collateral ligament. Next is the calcaneofibular ligament. And the severity of inversion ankle sprain is categorized by how these ligaments are torn. The severity of the inversion ankle sprain is divided into 1 to 3 grades. The photo on the far left of the slide is grade 1 with the most minor injuries. Conversely, the photo on the far right of the slide is grade 3 most seriously injured. The photo on the far left. In general, grade 1 is a state in which only partial tears of the ATFL occurs. Next, the photo in the middle. Grade 2 is a state in which complete tears of the ATFL occurs. The photo on the far right. Grade 3 is a state in which complete tears of the ATFL occurs. Grade 3 is a state in which complete tears two ligaments, ATFL and CFL. In addition to these two ligament tears, it is said that PTFL may also be tiered. So far was the inversion ankle sprain in the case of adults. I mentioned that the adult inversion ankle sprain damages the parenchyma of the LCL. On the other hand, in children, cartilage injury, containing avulsion fractures may occur at the ligament attachment. In the inversion ankle sprain, the pulling force acts on both the LCL attached to the fibula and the bone at the attachment, but in adults, the ligaments are weaker than the bones, causing LCL tears. However, in children with immature and weak bones, avulsion fractures occur at the ligament attachment. In addition, there is a growing cartilage plate called the epiphyseal line at the tip of the bone in children. If this epiphyseal line remains, an inversion ankle sprain may pull the epiphyseal line of the fibula and damage it so that it separates. If your child is sprained, go to a hospital or clinic where you can get an X-ray and have your doctor check it. If you do not treat or fail to treat after inversion ankle sprain, you will get CAI, chronic ankle instability. In this state, even with weak inversion stress, it becomes easy to sprain. An inversion ankle sprain will be repeated. CAI is defined as a condition in which ankle sprain is more likely to recur due to structural changes such as loosening of ligaments and changes in joints, and instability due to functional changes in muscle strength and nervous system. According to Mr. Attenborough, the recurrence rate of inversion ankle sprain is 27% to 61%, especially in soccer and basketball. In addition, if CAI continues, it is said that there is a high possibility of osteoarthritis, in which the bones and cartilage of the ankle joint are damaged and deformed as shown in the model on the right. In this way, I don't think it's okay to have an ankle sprain, and it's important to treat the first injury and prevent it from recurring. Please see the video of the treatment section to see what kind of treatment you will do. When you have an inversion ankle sprain, LCL is not the only tissue damaged. Sometimes even adults have broken bones. Therefore you should see a doctor immediately. However, there are some things that cannot be done easily. There are evaluation methods called Ottawa ankle rules to identify if you may have a fracture at such times. This evaluation confirms whether it is painful by pressing tenderness the 4 designated points. Or check if you can walk more than 4 steps. If any of these are true, it is judged that there is a possibility of fracture. The 4 designated locations are 1. At the posterior part of the fibula 6 cm from the tip of the lateral malleolus. 2. At the base of 5th metatarsal bone. 3. At the posterior part of the tibia 6 cm from the tip of the medial malleolus. 4. At the navicular. The sensitivity of this evaluation method is 98.2 to 100%, which means that if there is a fracture, it will be extracted almost completely. However, the specificity is 42.3 to 77.1%. That is, even if there is no fracture, it is judged that there is a fracture with a probability of 40% or more. I'm a little disappointed in this part. However, if you suspect a fracture and go to the hospital and the X-ray shows that there is no fracture, it may be a blessing in disguise. There is also a Buffalo rule, which is an improved version of Ottawa, ankle, and rules to compensate for this low specificity. In any case, see your orthopedic doctor as soon as possible to clarify what is and how much damage you have. We talked about inversion ankle sprain under the theme of what is a sprain. If you or someone around you has a sprained ankle, see a doctor at a hospital or clinic that offers ultrasound and MRI in addition to X-rays. Also, to prevent recurrence, seek guidance from a physiotherapist or other qualified rehabilitation specialist. If you have any information that you can use for your convenience, please subscribe to our channel. We will continue to provide useful information to everyone. The audio of this video uses OnDocuSign. The content of the video was created with reference to the materials you see. Thank you for watching.